Hi, how you doing today? I'm gonna come in and wash my hands. My name is Stephanie. I'm gonna be your nurse today. Can you please tell me your name and date of birth?
Brenda Ford, 10/23/62.
Okay, great. So today we're gonna do a head to toe assessment on you. So we're gonna look at everywhere from your head down to your abdomen and see what's going on with you today. So we're gonna go ahead and start with your head. I'm gonna look for facial symmetry. So what I'm looking for is looking at your nasal labial fold as well as your palpebral fissures. I'm gonna go ahead and take a look at your head and scalp. The head is normal, so phallic. No bumps or lesions.
Feels good. Keep doing it.
Hair is blonde and shiny. Looks healthy. I'm gonna go ahead and palpate your temporal artery. Now please open your mouth and shut it again. Okay, thank you. Now can you clench your teeth? Good. Can you smile? Good. Puff your cheeks. Squeeze your eyes tightly. And go ahead and wrinkle your forehead. Great, thank you. Okay, now we're gonna test your extraocular movements. So please focus on this pen light and move just your eyes and not your head. Great, now the other side. Good. Now we're going to do the visual field test by confrontation. So I'm going to go ahead and cover my left eye. Could you cover your right eye, please? You want to be opposite of mine. Okay. I'm going to go ahead and sit here. Now tell me when you see my finger in your field of view. Ready?
Now. Now. Now.
Okay. Now switch eyes.
Now. Now.
Good.
Now. Now.
Good. Okay. Now I'm going to go ahead and dim the lights. Okay, no problem there. I'm going to get my pen light. And we're going to test your pupillary reaction. Just go ahead and look at that picture behind me. Good. And the other side. Excellent. Okay, when I did that pupillary response test, your pupils were direct and had a consensual reaction to light. They constricted, and they constricted on both sides simultaneously. I'm going to go ahead and look at your ears. Okay. They look small, no deformities. Please let me know if it hurts at any time while I'm palpating your ear. Any tenderness or pain?
No.
Okay, I'm going to go ahead and look at the other side. Okay.
I got that.
There's some tenderness there?
Yes.
Okay, we'll note that. Okay, now we're looking at the nose. The nose appears to be symmetrical. No deviated septum. Brenda, could you please occlude one nostril and breathe in for me? Good. And the other side? Okay, a little less airflow on that side. Do you feel any pain or tenderness when I touch?
No.
Good. Okay, now we're going to go ahead and inspect the mouth. The lips are pink and moist. Can you go ahead and open your mouth for me? Stick out your tongue. Thank you. All right, the teeth are white. The uvula is intact. Hard and soft palate are intact. A few cavities in there, but nothing to note. Can you put your tongue up on the roof of your mouth? Thank you. All right.
No cavities, fillings. Brat.
I'll edit that out.
That's
Okay, stick out your tongue for me. Move it from side to side. Now push it against your cheeks on the inside of your mouth. Good. The tongue is symmetric and cranial nerve 12, the hypoglossal nerve, is intact. Now stick out your tongue and say ah for me.
Ah.
The uvula is midline. Now close your mouth and swallow. All right, both the cranial nerves 9 and 10 are intact. Okay, now I'm going to go ahead and look at your thyroid gland. So we're looking at the hyoid bone, the thyroid cartilage, and the trachea. They're all midline. So I'm going to go ahead and come behind you. Okay. Scoot up, please. I can't. This thing is really far back. Okay. So I'm going to go ahead and palpate your thyroid gland by displacing it and pushing with the other side. And checking it on the other side by displacement as well. Okay, could you swallow for me? Take a drink of water. Okay, good. Okay, now I'm going to palpate your neck nodes, starting with the pre-auricular, post-auricular. Can you turn your neck to the screen, please? Post-auricular, occipital, tonsillar, submaxillary, submental, anterior cervical, posterior cervical, as well as the supraclavicular. Okay, now I'm going to palpate your carotid artery. Lift your neck up for me, please. Thank you. Okay. And then the other side. Good. 2+ bilaterally. Now I'm going to go ahead and auscultate using the bell of my stethoscope. We're looking for any bruit sounds. Neck up, please. Thank you. On the other side. Okay, no bruits heard. Okay, now I'm going to auscultate the heart in a Z pattern, starting at the aortic area. Moving on to the pulmonic. Erb's point. Tricuspid. And finally mitral. There are good heart sounds and no murmurs. In the apex of the heart, you hear S1 and S2 greater. In the base of the heart, you hear S2 greater than S1. You can use the bell of the stethoscope to hear S3 or S4. Normally you don't hear any sounds unless there's any murmurs present. Okay, now I'm going to assess pulses. I'm gonna go ahead and look at the radial pulse bilaterally for 60 seconds. Okay, good. I'm also gonna go look at the posterior tibial pulse. As well as the dorsal pedal pulse. Okay, now I'm going to percuss the lungs on the posterior side. Both sides. So we're checking here for symmetry, and you can hear good resonant sounds. You can also percuss the anterior side to check the lower border of the lungs, called the diaphragmatic excursion. So now I'm going to check for tactile fremitus to feel for vibrations. Can you please say 99?
99.
Again?
99.
Again.
99.
Good. I can feel good vibrations when she says 99, and I can feel them symmetrically. Next, I'm going to auscultate your lungs. Posterior first, then anterior. So when I move the stethoscope, please breathe through your mouth.
Like that.
Take a deep breath.
I'm doing something for mommy.
Okay, take a deep breath.
I'm doing something for mommy.
Good. A deep breath. Good. Deep breath.
I'm doing something for mommy, Papa.
Okay, a deep breath. Deep breath. Deep breath. Good. Deep breath. Come under here. Deep breath. Do the other side as well. Deep breath. Okay, great.
Mommy, can somebody else hold this camera? I'm getting tired of holding it.
Okay, now I'm going to palpate for the costal vertebral angle. Let me know if you feel any pain or tenderness. Any pain or tenderness there?
Not that one, no.
Okay, great. Take your lungs from the anterior side. Take a deep breath. Move your hair. Another deep breath. Okay, breath. Again. Okay. Now can you slightly lift your arms? Okay. Last. More. Okay, great. Thank you for lying down for your abdominal assessment. The abdomen looks flat, symmetrical. There's no masses or protrusions. The umbilicus is center and also midline. I'm now going to auscultate, starting with the right lower quadrant. Right upper quadrant. Left upper quadrant. Left lower quadrant. The vowel sounds are empty. and normal. And now I'm going to use the bell side of my stethoscope to listen for vascular sounds. Starting with the aortic, the renal, femoral, I'm sorry, that was iliac, and then femoral. There are no bruits or swishing sounds. Now I'm going to percuss, starting at the right lower quadrant. Can you operate the camera for a second? Is it possible? Okay. Now I'm percussing. You can hear good tympanic sounds. Have you emptied your bowels today?
Yes, sir, ma'am.
Have you felt any pain when I was percussing your abdomen?
No.
Now on a normal day, do you feel pain?
No.
Now I'm gonna percuss the liver. Hearing a dullness over the liver. I'm going to palpate the right lower quadrant. Do a deep palpation. Do you feel any pain?
No.
Do you feel any pain?
Nope.
Okay, doing a deep palpation. Tell me if you feel any pain or tenderness. Put those back, please. No masses or tenderness. Okay, now we're going to palpate the liver. Can you take a deep breath? Good. And the spleen. This side, my hand is underneath her. Pushing up, take a deep breath. Now the spleen should not be palpable, which is not on her. Good. Now we're going to palpate the kidneys. Checking both sides. They're not palpable with either hand. Now palpate the aortic artery just above the umbilicus. And I'm going to use my thumb and my middle fingers to check pulsations. At about 2.5 to 4 centimeters deep. And I feel some pulsation, so that's good. Okay, now we're going to do our neurological assessment. So you're going to go ahead and push your head against my hand. Good. And now the other side. Now shrug your shoulders against resistance. Good. Perfect. Thank you. Now we're going to test coordination. So you're going to alternate tapping your hands and your palms to your knees. So it looks like this. Can you go ahead and do that for me? Good. Good hand-eye coordination. Okay. Now you're going to use your thumb to touch each finger, and you're going to go backwards. Touch each finger, and then go backwards. Go ahead. Good. Okay, now with your index finger, you're going to point to my finger wherever I move it. So point with your index finger, point to my finger. Go ahead and touch it. Okay, now we're gonna do the heel to shin test, which tests coordination of your low extremity. So you're gonna take your left. Okay, now we're gonna do the heel to shin test. So you're gonna take your left heel, bring it to your knee, and then slide it all the way down to your shin. Good. Now the other foot. Slide it all the way down. Good coordination. Now I'm going to test the deep bicep reflex. So go ahead and flex your bicep for me here, and I'm going to find that deep tendon using my toy reflex hammer. That's all I got. Good. Okay, now we're going to test the patellar reflex. Good, normal reflex. Now the Achilles, hold the foot steady. Good. Okay, now we're going to test position sense. So go ahead and give me your finger. And I'm going to move your finger. Close your eyes. And you tell me which direction I'm moving your finger.
Up, down, to the left, to the right.
Now I'm going to do multiple.
Up, down, up, down, down. Left, left, right, right.
Good. Now can you stand up for me, please? Okay. Now we're going to do the Romberg's test. Hands at your side. Lift the camera up a little. See if I can put it somewhere else. Okay, now we're going to do the Romberg's test. So close your eyes with your hands at your side. And I'm going to test your balance. So I'm going to just give you light taps to see if you can hold your balance. Making sure to support you. Okay, so that you don't fall. Okay, great, thanks. Test your gait. Go ahead and walk towards me. Just normal walking. Good, steady gait. Now you're gonna go back. Wait, before you go back, you're gonna go heel to toe. So walk heel to toe. Nice and steady gait. Good job. The patient had good control and balance, and that's gonna complete my head to toe assessment. I will now remove my gloves, wash my hands, and document. Thank you, Brenda, for participating.